lady truths. We're here to talk, no shame, no sleuth. Laugh, learn, and feel empowered. Your body talk, uncensored and flowered. Let's talk titties and kitties. Smart, sassy, and totally gritty.
Hey ladies, welcome to the next episode of Let's Talk Titties and Kitties, where we take the mystery out of women's health and we'll replace it with glitter, a lot of laughter, and maybe a bit too much information. So what are we talking about today? We are taking the mystery out of vaginal discharge. So let's start. What is normal vaginal discharge? Kind of think of it like your vagina's housekeeper. It sweeps out old dead cells, keeps things moist, keeps things healthy. Kind of like a self-cleaning oven, but way cooler. So what is normal? So normal is thin, clear, milky, maybe stretchy, sometimes a little thicker, kind of a stretchy consistency when you're ovulating. Yes, you can definitely tell the difference in your discharge by where you are in your cycle. Whether you're pregnant, where you turn on, it kind of has its own mood swings. So what do we see when your discharge is sending up red flags? So some things you might see are like green, yellow, gray, or chunky cottage cheese-like discharge. Those are all abnormal. Also, either a strong scent or a really fishy odor is abnormal. And anytime you're having any burning, itching, or irritation. These can be things like bacterial vaginosis, usually it's called BV, a yeast infection, or even a sexually transmitted infection. So if your discharge looks like it's from a sci-fi movie, you probably want to call your provider. So what are some pro tips from this kitty whisperer? Wear breathable cotton undies. You want to get your lady bits some fresh air, okay? Avoid scented soaps or douches. Never ever douche. That will completely mess up the pH of your vagina and you are setting yourself up for an infection. Your vagina has a pH for a reason, and you are not a Yankee Candle. You don't need to smell like roses. And then keep track of what your discharge is like for you normally. Again, it can change throughout your cycle, so it doesn't have to be the same all the time. But if you notice something is different, the color is different, you're itching, you have an odor that's not normal, make sure you keep an eye on that. You're the only one who's going to know what's normal or not for you. Everybody's a little different. So what to do if you notice something different? So first of all, don't freak out. Most of the time it's normal and treatable, okay? So here's what you're looking for. If you have a yeast infection, that's a cottage cheese, thick discharge, itching, irritation. Over the counter, you can do treatments like miconazole, clotrimazole, anything that ends with azole. Those are all fungal treatments. You can use creams or suppositories. You buy those over the counter, and you can use anywhere from like 1 day, 3 days, 7 days. It's just kind of what you prefer. So prescription medications for yeast infection. It's medication called fluconazole or diflucan. It's a pill, and usually you take it once, sometimes twice or 3 times, depending on your provider's preference. Bacterial vaginosis. The most common symptom is that fishy odor, thin gray discharge, different than normal. Although there are no technical over-the-counter medications, you can use boric acid suppositories in the vagina. Don't make me explain to you why I have to say in the vagina. Don't swallow acid. So you can use those twice a day up to 2 weeks. Anything longer than that, if it's persisting, go see your provider. But when it comes to medications that are prescription, there's an oral medication called Flagyl or metronidazole, and a vaginal medication called Metrogel, which is also metronidazole, just 2 different ways to take it, orally or vaginally. Really up to preference and what your provider is comfortable with. Tip with Flagyl: do not drink alcohol. It upsets your stomach and causes vomiting. You do not want to be drinking alcohol while taking this medication. You will immediately regret it. So, sexually transmitted infections, things like gonorrhea, chlamydia, trichomonas, All of those can cause vaginal discharge changes. The treatment is always a prescription treatment. There is no over-the-counter treatments for these. Please seek your provider if you feel like you are having, you have an STI or you've been exposed to an STI. And don't try anything at home. It has to be seen by a provider. And please don't be embarrassed. Gonorrhea, chlamydia, trichomonas, they are all common, especially in younger people. So your provider has seen it all. We're not going to judge you for it. And the treatment is an antibiotic, so nobody at the pharmacy is going to know what you're getting treated for. Okay. So basically, the stuff you can handle at home, handle at home. If it persists, keeps going, gets worse, go see a provider, okay? So what it boils down to, if you see discharge, don't panic. It's maybe just your body having a little bit of a mood swing, okay? If you notice anything abnormal, try the over-the-counters, go see your provider. If you have been exposed or think you have been exposed to a sexually transmitted infection, please, please, please get in to see a provider, okay? So remember, knowledge is power, and so is a spare pair of underwear. So see you next time, and let's talk titties and kitties.